Yes, it's true. Lots of questions came in regarding chronic venous insufficiency and what is chronic venous insufficiency. In fact, chronic venous insufficiency is a result of human beings being upright creatures. Essentially, what happens is we have veins that return blood from the foot to the heart, returns blood from the legs back to the heart. And when those valves malfunction, blood pools within the veins of the lower extremity. Commonly, people experience varicose veins, maybe minor leg swelling. In some cases, spider veins is a common term referred to, but simply chronic venous insufficiency is the pooling of that blood within the blood vessels of the lower extremity. The symptoms of chronic venous insufficiency vary in spectrum. There are mild symptoms, which may include swelling of the lower extremities, especially with prolonged standing. It may progress to varicose veins, spider varicosities. In its most severe state, chronic venous insufficiency can cause people to have significant dysfunction when they walk, heaviness of their legs, discoloration of the skin, and maybe even ulcerations of the skin. These ulcerations can set the patient up for infection, and that can be very difficult to manage. When we think about the mild to moderate symptoms, generally speaking, we're encouraging patients to elevate their legs after prolonged periods of standing. We're also encouraging them perhaps to wear compression stockings that one can obtain over the counter or even medical grade compression stockings. In the most severe state of chronic venous insufficiency, where there's significant disability and when the patient may experience some type of ulceration, those patients, we encourage them to undergo an evaluation and consideration for what's called an ablation, either heating up the vein or closing off the vein with some type of radio frequency or thermal heat technology, which essentially prevents blood from flowing within the vein. And I can expand upon that a little bit more. The other common term that's circulating when one thinks about chronic venous insufficiency is deep venous thrombosis, or blood clots of the lower extremity veins. Deep venous thrombosis, when it's what's called acute new deep venous thrombosis, when there's new clot within the blood vessels that can actually break off, migrate, go to the heart or lungs and cause sudden death, is a cause of death beyond just the disabling symptoms of chronic venous insufficiency. The term chronic suggests that these patients are experiencing symptoms over time. Acute deep venous thrombosis, a different disorder from which patients can die, is usually a very sudden acute accumulation of blood clots within the lower extremities migrating to the heart and lungs. It's a different disorder. Acute deep venous thrombosis can cause scarring over time, and that can lead to chronic venous insufficiency. But in general, acute deep venous thrombosis, blood clots of the lower extremities, is different from chronic venous insufficiency. Whenever patients have medical conditions, they really want to know one major question: will I die from this disorder? And frankly, for chronic venous insufficiency, it's uncommon that one will die from that process. Chronic venous insufficiency is very common. Probably at the age of 70, most of our textbooks would suggest that greater than 40% of adults at that age have some form, mild, moderate, severe, of chronic venous insufficiency. These symptoms are related to perhaps our weight, our sedentary lifestyle. There are other coexisting medical conditions, including high blood pressure, cholesterol, which obviously contributes to elevated weight, which may coexist with chronic venous insufficiency. And of course, anytime we have a medical condition, we're looking to rule out and create a differential diagnosis to exclude some of the more severe disorders. And so other disorders one might consider for chronic venous insufficiency: lymphedema, that's a process where there's fluid that accumulates within the lower extremities. that has some similar treatments to chronic venous insufficiency. Peripheral artery disease, or PAD as it's known, that's when patients experiences blockages of the other blood vessels of the lower extremity. Those are the arteries that can cause reduced blood flow, and in their most severe state, potentially lead to limb amputation or major disability in terms of walking capacity for some patients. And when we think about some of the overall cardiovascular disorders, we think about congestive heart failure or heart failure, when fluids accumulate within the body, and those fluids cause leg swelling, lower extremity swelling, and those symptoms may be secondary to cardiovascular conditions, high blood pressure or dysfunction of the heart, which is a muscle which impedes return of blood flow from the legs, and that can cause chronic lower extremity swelling. And so that's why it's so important for patients to dialogue with their physician and not just attribute these findings and these symptoms to other things and dismiss these findings, but to discuss with their primary care physician so that this differential diagnosis can be entertained. And ultimately, it's very simple to diagnose chronic venous insufficiency. It really consists of a basic ultrasound, an ultrasound similar to what a woman with a baby, a pregnant woman might undergo, but it's simply an ultrasound that takes 10 minutes that can review and assess the veins of the lower extremity and determine whether a patient has chronic venous insufficiency or whether there may be some other cause of the lower extremity symptoms. Essentially, the takeaway is that chronic venous insufficiency in and of itself is usually not life-threatening. It can be disabling, cause mild, moderate, or severe symptoms, and in the most severe manifestation, those patients can experience ulcerations of the skin and potential for infection. That's usually not sudden in onset, but the challenge is really to identify chronic venous insufficiency in its most mild form so we can prevent the progression over time. And that requires a patient or a family member to take notice of the existence of the varicose veins, the spider veins, the lower extremity swelling, any of these early manifestations, mention that to their provider, and potentially when these symptoms have progressed, for primary care providers, patients, and families to understand that there are treatments ranging from very simply performed and relatively safe office-based procedures that address the offending veins that cause this disorder of chronic venous insufficiency.